Okay, the lecture 19. So instead that we plan to talk about spirochetes, the last group of gram-negative bacteria and some remaining anaerobic bacteria. I think I move anaerobic bacteria out because you learn some main anaerobic bacteria, gram-positive spore-forming Clostridium. There are some anaerobe, but I think it's not kind of the main disease for patient. So this lecture will go to spirochete mostly. Okay, let's start from morphology of bacterial spirochete. Actually, spirochete is kind of long helical. Think about the thread. The helical is so thin, okay? Corkscrew shape can multi. All spirochete can multi. They movement by flagella, but not propelling flagella like the other bacteria like E. coli, Salmonella. But flagella moving, let the cells grew in a viscous media. Okay, some spirochete. Well, when you study bacilli or cocci, you measure cell size because in any direction. So cocci is kind of sphere. So you probably think about diameter of the cells that determine cell size, which one bigger than another one. In bacilli bacteria, you probably measure the diameter and the length of the cells, that the dimension of bacilli. For spirochete. You probably measure the diameter that's super thin. Generally, is about 0.1 micrometer to 3 micrometer. It's so thin, okay? But the length of the cell is quite dramatically different from the diameter. Length can be 5 micrometer to 120 micrometer. That's super long, thin, curvy, okay? And another parameter for spirochete, because cells curvy, we measure the amplitude, how far from the coil turn to turn, how big of the turn. That also one parameter for identification of spirochete. Not so many spirochete in the whole kingdom of bacteria. They are all multi. Some spirochete can be tight or some loosely. The clockwise spring is not rigid, can move loosely up, something like spring. And most of them are slow growing until super slow growing. Okay, that's major characteristic of bacterial spirochete. So when we talk about spirochete in first edition and second edition Berkeley manual, you still remember Berkeley manual is manual to talk about the systematic of bacteria. They classify all spirochete in one phylum. And also one phylum, one class, and one order. That's why we don't care class, because just they are one, we call one phylum, one order. All spirochete are classified in the order Spirochetalus, okay? When you see the prefix ALES, that's order name. In the old classification, if you read textbook that older than 20 years, you probably classify spirochete in two families. One is Spirochetaceae. Another one is Treponemataceae. That's two family. And the family Treponemaceae contain genus Treponema, genus Borrelia, and genus Leptospira. But now, genus Leptospira split from this family to be a new family named Leptospiraceae. So we talk about two genus first. The first genus named Treponema. Okay, the Treponema can be some normal flora in human mouths. For example, Treponema denticola. Denticola cause tooth decay, ฟันผุ and also the serious thing is Treponema pallidum. Treponema pallidum can have, there are so many subspecies. One we call Treponema pallidum. That is the causative agent of syphilis. The second one is Treponema. Oh, this is wrong. This is Treponema pertenue. Sorry. Pertenue cause your in Thai called Kutalat. And this one, can't remember. I check that for you. Okay, we talk about, in this lecture, we'll talk mainly on Treponema pallidum. Okay, and then we move to the genus Borrelia. Borrelia contain 2-3 main pathogen. One is Borrelia burgdorferi, called Lyme's disease, and another one is Borrelia recurrentis, called relapsing fever, or ไข้กลับนะ relapsing fevers mean when you get fever and you recover and get fever and recover about 3 to 10 times, something like that. Leptospira has one pathogenic species, is Leptospira interrogans, called leptospirosis or โรคฉี่หนู Okay. Let's talk about the structure. No, we just move to the diagram, compare Treponema, Leptospira, Borrelia. This is the table to demonstrate the feature of spirochete that cause spirochetal disease. Okay, you probably compare it, 3 of these, and know the main disease they cause. Okay. Treponema. This is the picture of Treponema pallidum. Actually, we not perform gram staining in all spirochetes because it's so thin. Once it's thin, when you stain with gram positive and gram negative, it reflects color and it's so hard to tell this is blue or red. Okay, instead of gram staining, scientists use dark field plate, add in the light microscope. Once you add a dark field plate, instead of you observe the object will be grow up like a white object like this, or spiral object, and the background will turn dark. So this is very easy to observe the thin, very thin and hard to observe in the light microscope. It's like inward color. Okay. Treponema pallidum is so slender, so thin, okay, motile, sluggish. They move because they have flagella inside the periplasmic space. So you need to remember flagella of bacteria. When you learn flagella in gram positive, gram negative, they differ in the disc because gram negative have outer membrane. But for spirochete, For spirochete, flagella stay in the periplasmic space and the outer membrane. We use the term outer membrane for other gram-negative bacteria, but for spirochete, they name outer sheet, okay? So flagella never project out of the outer membrane or sheet. So something from environment cannot block flagella. And then they move screwing. That make flagella not shear and is very good for moving in a viscous environment, particularly muddy environment, cyclone, or in the tissue. If tissue is so viscous, okay. Almost all spirochete, including Treponema pallidum, are difficult to culture in the media, the synthetic media or whatever, artificial media. So the way that we maintain Treponema pallidum in the lab, we need to infect Treponema in a susceptible animal. In this case, we use rabbit. So if we maintain that, we just infect rabbit and draw Treponema from rabbit and infect another rabbit to be passage like this. The disease that caused by Treponema pallidum is syphilis. The transmission of Treponema, they have two different ways. One, we call the mode of transmission related to disease they happen. One disease called acquired syphilis. Acquired syphilis happen by the bacteria enter the human body by body fluid. Body fluid can be secreted or some fluid on the lesion. So it might be happen by you get wound or in cut it or you contact the wound of infected patient, and then bacteria in the wound of infected patient penetrate your skin or your mucous membrane. Normally, we found cases by infected in genitalia and mouth. Okay, in some of patients who, well, mostly happen by sexual contact, either oral sex, anal sex, or vaginal sex that can have risk equally. And also, if you, in some people, it might be infected with hand or some skin or wound if you touch to the infected area, okay? Or contaminated needle. The contaminated needle in drug abuse and direct skin, also skin lesion. That's maybe acquired syphilis. Another one for congenital syphilis. Congenital syphilis is disease that baby get infected from mother who sick with Treponema pallidum. Okay, so bacteria can infect baby in the uterus. Well, when mother get baby, bacteria can move past vagina up to the uterus. That's one way. Or when mother deliver baby pass through vagina and then they get infected by pass-through wound. And bacteria in the wound, the syphilis wound, infected to baby. That's congenital syphilis, okay? Pathogenesis of syphilis. Syphilis has, well, lots of textbook, they say 3 states, but actually syphilis has 4 states. The first one we call primary syphilis. Primary syphilis happen In the early phase, treponema pallidum enter human body by body fluid. The lesion here we call chancre lesion. Remember chancroid? Chancroid happened by Neisseria gonorrhea. If you remember, that is lesion with the very soft edge around lesion. Once it's soft, bacteria can have inflammation around and underneath the lesion, under skin. Okay, but chancre, the edge of the lesion will be lift up. Okay, they are painless lesion. Okay, this is the hallmark of primary syphilis, chancre lesion. Okay, in Thai we call แผลริมแข็ง but that one in Neisseria gonorrhea is แผลริมอ่อน It may appear in 10 days after exposed to the bacteria or up to 90 days. So you probably get infected and have no symptom up to 3 months. Okay. The common sign of the chancre is penis or labia, but can also found in anus, in oral mucosa. Okay. In case of sexual contact, chancre will appear external genitalia, will not go into internal. We'll see very easy, observe the chancre. Doctor will see quite easy. In the physical contact, you probably found patient who get infected on the hand palm. And other part of body, it depend on that part of body touch to the infected site. So can develop chancre here. And also the chancre lesion can fill with a lot of treponema pallidum. And this one can spread to the other side of the new area by auto-infection. Okay. But without treatment, so if you do nothing, I think people in the old days, we knew that because people in the old days so shy to go to see doctor. Do nothing, the chancre disappear itself by 2 to 8 weeks after you get symptom. That's the primary syphilis. When the disease undergo to the second phase, we call secondary syphilis. This is disseminate state. Okay, this is the spreading infectious state. The syphilis bacteria enter blood circulation. That happened around 6 to 12 weeks after infection. Okay, so spirochete goes into the bloodstream. Actually it is bacteremia, but for this case we call spirochetemia. Bacteria attach, well, when they go to the blood circulation, they love to attach endothelial cells, that is cells of the blood vessel, particularly in the capillary blood vessels near the skin. Okay, and cause non-itchy maculopapular rash. Maculo is macule, is the papularized kind of puts inside the rash. So you probably see the rash through the body. Actually, they start from some area and then spread through the body. In the secondary syphilis, this is the key symptom, the maculopapular rash. The rash can be pink, can be brown. Okay, so it happened more than 50% of cases. Okay. Another symptom we call mucus patch. The mucus patch happened in the oral cavity, the oral lesion. Look like this. This is the mucus patch. The lesion look like snail track. When snail moving, they left some track, the mucus track. This is the lesion of syphilis. And this state is the most infectious state. Well, usually recover, the symptoms disappear in several weeks after you get symptom or few months after symptom happen. That is secondary syphilis. Once they pass secondary syphilis without treatment, it probably go to the next phase called latent syphilis. The latent syphilis that refer to state that the bacteria dormant inside the patient, and mostly they are asymptomatic. Patient will have no symptom. So Treponema pallidum stay in capillary and spread to so many organs. They stay in capillary of so many organs, so many tissues in the body. That happened about a year after infected. Okay, so we divide the latent syphilis into early latent and late latent. Okay, in this manner we refer to early latent syphilis, or sometimes we call latent. So syphilis come back to the blood circulation. Some patient who has no symptom for a long time, when they get latent syphilis, bacteria come back and might get the primary and secondary syphilis again, will loop back to the symptom and lesion. That again, just treat it very easy by a dose of penicillin. It's perfect. Okay. For people who get latent phase, sometimes called tertiary syphilis. That's the latent phase. Bacterial spirochete in blood circulation go to the bloodstream and cause severe immune response in so many organs. They cause type 4 hypersensitivity reaction involving with cell-mediated immune response. They lead T cell to release interleukin 1, interleukin 6, TNF alpha. That's caused so many immune response that kind of severe inflammation happen. Or sometimes they call so many immune cells to surround bacteria. Okay, one immune cells cover bacteria, kind of a ball inside contain bacteria we call gamma. That's look like ulcer inside the internal organ. Gamma make tissue close, make the bacteria close by tons of immune cell, and inner part of the gamma start dying by necrosis. And that have, once the cells die, the tissue also die by necrosis and finally end up with organ damage. That's tertiary syphilis. Syphilis also can infect into brain, into the cardiovascular system, can be neurosyphilis. Finally, they get infected to brain, past blood-brain barrier and cause meningitis also. Another disease that caused from treponema is pertenue, cause yaw, and calatium, cause pinta. Pinta is kind of how can I say, the lesion on the skin lesion. Well, mostly treponema cause skin lesion. This one is interfere pigment, make color pale. That is your, okay. The second one, the genus Borrelia. Borrelia, it is gram-negative mold-type. Well, same. We not stain Borrelia by gram, but in this picture we stain bacteria by giemsa stain. Giemsa stain chromosome, okay? So we probably see bacteria in a high magnitude microscope, see bacteria in coffee, but the size of bacteria is kind of bigger than syphilis, okay? They contain, depend on species, maybe 15 to 29 flagella. Okay? Let's see this thin red, you see like so thin compared to the size of red blood cells, but Borrelia is so long and very hard to observe. This is Borrelia recurrentis. It is microallophilic bacteria growing well at 28 to 30 degrees Celsius on Kelly medium, okay? They cause relapsing fever. And the key symptom of relapsing fever is high fever. It's about 40 degrees Celsius. Patient probably feeling cold, shaking, and chill, okay? That is main symptom. Fever will subside in 3 to 5 days. So you get fever 3 to 5 days, and then fever disappear for about 5 to 10 days, and then fever come back 3 to 5 days, and back and forth like this about 3 to 10 rounds of relapsing. That's relapse fever. So Borrelia burgdorferi, Borrelia is so rare in Thailand. So in the textbook, probably not talk about Borrelia much. But if you go to study further in microbiology in Europe or the US, you probably learn Borrelia burgdorferi quite a lot, because the disease are commonly in the US and Europe, okay? Borrelia burgdorferi first identified in 1975 in Connecticut in the small town called Lyme. That's why they named the Lyme disease, okay? This bacteria need vector. The vector is Isodis, it's tick, okay, Isodis. This disease, I mean Lyme disease, is absent in Thailand because in Thailand we don't have that kind of tick. This is the tick of deer, okay? So they are very common in Europe, particularly, well, the Northern Europe. Well, when people go in the field in spring and summer, go to pick up berry, go to pick up some mushroom in the field, they probably go to the bush or tree that have so many tick, because that are the area, those are area in the shallow or deep forest. So that's also the area that deer can expose to the habitat. So they left the tick, and tick can carry bacteria inside that, okay? When tick get bacteria, they probably get into the tick gut, okay? They eat bacteria and contaminate in the intestine of tick. And once tick bite human, they probably get regurgitation. So the content of the gut may be gurged out of the tick and then contaminate when the tick bite human. So main symptom of Lyme disease is big rash kind of expand in size every day. That's what you need to know about Borrelia. The next one is genus Leptospira. So Leptospira formerly classified in different family, but they later on moved to family Leptospiraceae. Okay, this thing in the old day, but it depends on if you go to the library and you pick up some paper or sheet in the internet. You probably know if they're older than 10 years from now or 15 years from now. Most of the book say Leptospira contain two species. One is Leptospira interrogans. Another one is Leptospira biflexa. Okay, interrogans and biflexa, just two species in this genus. The interrogans play a role in pathogen for human. They comprise, well, in classically, scientists divide interrogans into more than 250 serovarieties. Okay, that's very much. And also biflexa comprise more than 60, maybe 60, 70 serovariety. That's the former classification. But later on, the serovariety cause cross reaction by immune response. So we classify bacteria based on the antigen on the surface of the cells, and an antibody that used for classify bacteria are polyclonal antibody. So polyclonal antibody that recognize to a set of epitope, right? Some set of epitope share, maybe different sets share some common epitope that make the antibody cross react to the other bacteria. That make the interpretation is not clear cut to be this serovar or that serovar. So some serovar may cross react with the other serovar. This make classification, identification of Leptospira interrogans and biflexa is so difficult. The new way, scientists based on bacterial genome. Okay, once they based on bacterial genome, they reclassification to be 20 up to now maybe more than 23 genomal species. Okay, we can call 23 species, but I put the term to let you know this species came from the comparative of genome sequence. Okay, in 23 genomal species of Leptospira, they still name Leptospira interrogans. That make the field of scientists so confused. Like when I say Leptospira interrogans, I don't know you mean Leptospira in the classical classification or Leptospira interrogan for genomal species. Then they put the term, the Latin term sensulato and sensu stricto for systematic way of bacteria. Leptospira interrogans sensulato, that means the former species. Well, I say interrogans contain more than 250 serovar. If I want to point to Leptospira interrogan just for genomal species, I need to use sensu stricto. That means in the strict sense, I mean this group of Leptospira only, not the other. So that's the taxonomy you probably need to know. The general characteristic of Leptospira, they observe Leptospira under dark field microscope. You see the cells. Leptospira is so thin, okay, so tight. The coil is loose, but main characteristic, but not show in all cells. But most of the cells you need to see in so many oil field. They probably show up with hook, this hook in one side or both sides of the cell. That's okay. But bacteria without hook, that's also okay to be Leptospira interrogans. So observing hook need expert, need training. This is electron micrograph of Leptospira on the membrane filter. You see membrane pore. Bacteria is so thin, and some can pass through the membrane pore, the bacterial filter membrane. So when you learn in general microbiology, when you filter things that filtrate all bacteria out, it not probably true. The membrane filter cannot filter spirochete because it's so thin. Mainly of spirochete, they infect animal. The reservoir of the bacteria is the animal. Human is not the main reservoir. And the transmission mode from we human can get infected from contact with infected animal or can contact with infected water in the environment. The water in that environment probably need to contact with the infected urine of animal. Okay, when animals shedding urine in the pond or river probably rare, pond where the water moves not fast, and humans go to play water, swimming, whatever, they can infect it to soft tissue. Leptospira are obligate aerobic. Okay, they cannot grow in an aerobic. They die easily. They grow slowly. Okay, unlike the other species that axial filament or polyplasmic flagella contain like number of flagella, but L interrogans process two flagella, one each in the different side of the pole. Okay, that's the flagella of Leptospira interrogans. Epidemiology, these bacteria are zoonotic disease, cause zoonotic disease because humans get infected from animal. There are no reports that human get infected with another human. For example, Leptospira patient can pass bacteria. Well, bacteria shedding out in urine, so human use bathroom, right? So the spreading from human to another human is impossible. So transmitted from environment, not only fishermen go to fishing, particularly fishermen, I mean freshwater fishery, not marine fishery. Freshwater fishery, people probably go in the water and capture fish by traditional Thai style or Southeast Asian style in Indonesia, in Malaysia, in Vietnam. They probably get infected. Bacteria live in water and surface of the soil. Bacteria can infect to human by domestic animal or livestock. Also, most common reservoir should be, well, the first identified we know is rat. That's why we call โรคฉี่หนู. Okay, dog also cause problem. Leptospira in dog can cause asymptomatic or very mild infection and chronic for a long time. Farm animal like cow or pig also get infected with Leptospira, and also wild animal. Well, when we expose to Leptospira in the environment, Leptospira interrogan penetrate to the skin by the tiny break in the epidermis of the skin, or maybe they penetrate to the mucous membrane directly. We have so many cases from sport competition. I don't know how to say the sport that you probably need to play three things like swimming, biking, and running together to kind of competition. In Malaysia, after sport over, the spotter, when they went back to the countries, they caused sickness. And finally, we know that outbreak of Leptospira interrogan. The disease of this called leptospirosis. This disease is so-called occupational disease. Occupational disease means disease that related to some occupation. Well, the good way to diagnose leptospirosis interrogans, doctor always asking for the patient, like if patient are rice farmer that have high risk, or in southern Thailand, probably rubber farmer also get infected a lot by leptospira because they walk bare feet on the soil that probably contaminate with the urine of infected animal. So moreover, patient who's farmer and experience handling animal, if they coincidentally handling infected animal, that probably high risk of infection. And this disease also called seasonal disease. Seasonal diseases mean like they boom, disease boom or outbreak in some season. In Thailand, they boom in the late rainy season, particularly after event of flooding. If we have severe flooding, bad flooding, or in the during time when poor sanitation area and happened by flooding, well, when water flood, water bring a lot of massive water, and the massive water move quite quick. They contain high oxygen. When they reach the area that they stop moving and stay in the local area for a long time, oxygen will be consumed by aerobic bacteria, and then from the massive water tend to change from aerobic to microaerophilic. That is perfect for leptospira interrogans. And also in the area of flooding, rats cannot stay in the nest. They coming, urine leaking in the flood. That's make human get infected very easy. Okay, that's the situation in Thailand and Southeast Asia. But in Europe, they come with after raining in autumn. So the seasons, the case depend on the month. Okay, transmission, actually, rat can be a symptomatic rodent carrier. So rat have no symptom, even they get infected. They shedding out by urine. Bacteria can infect another rat in the population of rats. Okay, and rat can go to the house. Okay, and pee in the house of human. Human coincidentally need to clean the rat exudate, something like that, or probably get occasional or accidental infected. Okay, rat probably go to the natural habitat by soil and water in the rice field and get contaminated to the natural, well, not domestic rat, but natural rat in the field. So bacteria cross in so many animals. And also bacteria still spread to the other mammal also, including deer, cow, goat, sheep, lamb, even bats. This wild animal. So wild animals sometimes bring disease to the farm, and farm get infected, cow get infected. Well, in the farm probably keep some dogs, right? Dog go to the cow farm and get infected from cow, and dog bring disease back to the house that contact human. That's why the cycle is very kind of complex. When human get infected, if they infected to the skin, they probably get a rash, so many symptoms like, let's see this picture. Okay, that's why. If you swim in the area of water that contaminate with the urine, you probably get infected in eye and cause conjunctivitis, ตาแดงนะ bacteria probably cause headache if they go to blood circulation and pass blood-brain barrier, cause meningitis, and also cause stiffness. It means you cannot move the head easily, and so pain around the neck and head and neck. Okay, if they go to the heart, they probably get myocarditis, infected, make the heart tissue inflammation. If they go to lung, they probably cause hemorrhage, pulmonary hemorrhage syndrome. So blood circulation leak in lung and fill the blood in the alveoli. That's make severe symptom. Or hepatic dysfunction. Hepatic dysfunction by infected into the hepatocyte and probably come up with the jaundice. Jaundice is pale yellow skin, something in eye and skin. And classic symptom, they infect kidney, cause renal failure, okay? The virulent factor of leptospira, they process so many things. Without any machinery, they invade to the tissue of human. That's, if you still remember, bacteria can cause disease by 3 main mechanisms, right? Invasion, toxicity, and immunogenicity. These bacteria use all 3, okay? Bacteria probably invade and cause tissue damage itself. And bacteria still, well, gram-negative bacteria, they process lipopolysaccharide that cause inflammation. They're toxin. They have so many adhesion molecule that's adhesin. They can attach to epithelium, attach to monocyte, and attach to macrophage and go inside the cells. They have sphingomyelinase C toxin that can digest sphingomyelin and cause epithelium, destroy red blood cell that contain a lot of sphingomyelin. Epithelium capillary, they make hemorrhage happen, okay? And there still have a lot more virulent factor that's still unknown for this bacteria. Clinical manifestation of bacteria contain general clinical is classical. We call febrile illness. This term you probably important. Febrile illness means disease that cause fever with unknown cause. Well, there are like tons of disease, about 30, 40 disease with fever kind of main symptom, but we don't know what is the causative agent. We call febrile illness. Okay, the fever, and in general, you just get fever. But if they go to the late state, the second or severe state, we probably call the veal disease. So if you read textbook and you see veal disease, leptospirosis, that's same disease. If you go to the liver, attack liver, probably get hepatitis. If you go to bacteria go to the lung, they cause lung hemorrhage, bleeding in the lung. Okay, and if you get infected and bacteria go to kidney, that make kidney failure and also meningitis. Okay, same with the previous slides, but this is symptom. Okay, treatment of bacteria use penicillin G. That's bacteria never resist to penicillin, but in case of patient who get allergy to penicillin, doxycycline is alternative treatment. Or maybe in severe case, we probably use IV fluid or use the respiratory support for breathing. Okay, and diagnosis, use ELISA, dark field, and PCR that can detect. That's all about spirochete. Okay.